This is an incredible crowd of nurses and people who support the nursing profession. And it's inspiring to look out and see all of you. You are indeed an inspiring group. And I wish all of you could be here and see what I see. Nurses are 3 million strong. You're the largest group of health professions in the country. Gallup polls routinely says that you're the most trusted profession, and for good reason. Nurses routinely deliver care expertly and compassionately. You help people during their most vulnerable moments. Nurses play a key role in the transitions that people play when we are born and when we quietly leave this world. And as nurses, you do that without fanfare. You just do it compassionately and competently. So we know that you are a key to what we want to do. But you're also a key to what we want to do in improving the health of the nation. Nurses work in our communities, you work in our schools, you work in the places where we manage chronic illnesses. You work with new parents when they're trying to figure out those daunting first few months of how to take care of a new child. Nurses are the ones who are always helping us live healthier and better. We cannot build a culture of health without nurses in all of the places that make a difference, in our schools, in our boardrooms, in our city council meetings, and even in Congress. So when I talk about building a culture of health in our communities, we are focused on nurses, absolutely. Now, by now, you've heard us talk a lot about building a culture of health and our commitment to that vision. And I know that some of you are wondering, how are we going to actually realize it? Well, we know we're never going to realize it without nurses, because so much of what you do is building a culture of health. And we believe that so much that that's why in 2008, we funded the IOM to develop this report to examine what the obstacles were that were preventing nursing and the nursing profession from realizing all of the potential that it has to improve not only health care, but the health of our nation. We wanted to know how we could be better preparing our nursing workforce, not just for today's problems, but for all of the problems facing us in the 21st century. And it turns out, as Victor Zhao has already mentioned, that a lot of people were interested in the answers to those questions. Because, as he said, the Institute of Medicine report, when it was issued, was immediately the most downloaded report. And in fact, on that day, it temporarily shut down the IOM website. Yeah. And as he said, it's remained the most downloaded report that the Institute of Medicine has had. So the recommendations that we've heard about laid out a clear sense and direction for how we could empower nurses to reach their full potential. And we've heard that over the last 5 years, this group, these action campaigns, have really made a huge difference in implementing those recommendations and making them a reality. The campaign action platform, and I call it that because it is an action platform created by nurses across the country to, in partnership with others, really focus on how we're going to ensure that nurses reach that potential and all of the opportunities that nurses have in their education, but also make it easier for nurses to continue to advance their education and to continue to meet the goals of improving their own communities. This past week, the Institute of Medicine released another report, a progress report, call it a halftime report card, on how we're doing on achieving the future of nursing. And we've heard that there's been tremendous progress, and we're thrilled about that. But we've also heard that we have some work to do. So in a minute, Victor and I are going to sit in those comfortable chairs and talk with you about what we might do together. I'm glad that Susan Denser is going to be here to moderate that. But what I want to do in the interim is give you a sense of how what you've already done can help us achieve a culture of health. Because as I've already said, we're not going to achieve that without nurses. And let me be very clear about something. Because in talking to people here and around the country, I've heard people say, you know, you're committed to this culture of health, but doesn't that mean that you're turning away from your commitment on nursing and on the future of nursing? Nothing could be further from the truth. So if you take away only a few things from my presentation today, I hope you'll take away that RWJF is reaffirming our commitment to nursing, to supporting the recommendations of the IOM report and the progress report that we've heard about, and particularly to making sure that we can implement those recommendations. Why? Why? Because, frankly, those recommendations are the building blocks to building a culture of health. If we're going to achieve a culture of health in this country, we have to have a vibrant nursing profession that's committed to improving the health of individuals, but also committed to improving the health of their communities by working with partners from a whole variety of other sectors who are leaders in their own right, but who have something to contribute to building a culture of health. I've used this term a lot. You've heard me say a culture of health. And when I look out and see your faces, I know some people are trying to parse, well, what does she actually mean by that? Well, let me start with the word culture. You know, last year, the Merriam-Webster Dictionary defined culture as its word of the year because people use it in so many different ways. We talk about it in terms of our music and our art and our history and the foods we like and our ethnic heritage. But in this context, when we talk about culture, it really comes down to the way we do things around here. The way we do things in our families, the way we do things in our communities, in our schools, in our individual hospitals or clinics or workplaces. In fact, the way we do things as a nation. So when you think about culture being overwhelming, break it down to, it really means changing the way we do things in our local environment. And when we talk about a culture of health in that way, we realize the phrase may mean different things to different people, and we may put different emphasis on it. Some people talk about a culture of well-being. Others put an emphasis on it being a culture of caring and care. Others maybe a culture of empathy. It's all of those things. But whatever you call it, a culture of health means providing the opportunity for everyone to live the healthiest life they possibly can. Because in a culture of health, our children's health is a matter of fact, not a matter of chance. And in a culture of health, our kids learn to be active and to eat right and to play in safe places and to spread that to other children, no matter whether they're at school or home or whether they're on the playfield. In a culture of health, high quality, efficient, affordable health care is available to everyone, no matter where, when, or how they need it. And that care is as much about actively promoting health as it is about treating illness. And in a culture of health, our industry leaders really understand that well-being of their employees boost the bottom line and vice versa, and they are committed to doing their part to making sure that their employees and their communities are vital and productive. Now, I know this is a vision that everyone in this room shares, and I believe that we can achieve it. And I believe that because nurses live and work in all of the places that I've just mentioned. You know, nurses understand this as a part of their DNA and as a part of their training. And if we're going to grow a movement that builds a healthier world for all of us, we have to include nurses. You know, you're a force to be reckoned with. Yeah. Not just because of your sheer numbers, but because you have a strong will. And if there's one thing that this campaign for action has shown, is that you have a strong will and a commitment that can get realized in a very short period of time. Just think about the progress that has been made in implementing the Institute of Medicine's recommendations. That is a testament to your strong will. Yeah, go ahead, give yourself a hand. Not only that, but you're passionate about your work, and you're passionate about the care that you give. You know that you can get difficult things done, and you do. So let me emphasize again, nurses work or live in all the places that it's going to take to make our nation healthier. Hospitals, schools, nonprofit organizations, city councils, even Congress. Now, I know that a lot of you in your action campaigns have already been brainstorming and strategizing about how you can make this culture of health a part of your mission. In fact, I saw someone has even put it on their business card. I love that. But making the kind of new connections that we're going to need to do that is something that we'll have to talk more about later. And we're going to need to encourage the new leaders, like the 10 culture of health leaders that you're going to be honoring later on today, to do that in a greater way and to exemplify that kind of behavior for other nurses. Change won't happen unless we integrate across our sectors and across our programs and across our campaigns in order to accelerate progress. The factors that we need to improve health don't exist in isolation, and neither will the solutions. So that means that all of us have to get out of our comfort zones and work across sectors. The progress report really emphasized the need for broader stakeholder engagement, and it's clear that nurses are committed to doing that. And we at the Robert Wood Johnson Foundation have to continue to ask ourselves, ask you, and ask the nation how we can improve our working across sectors with business, educators, urban planners, architects, faith leaders to achieve these kinds of goals. We have to help sectors work between those traditional boundaries, and we have to ask ourselves how our actions can be better connected to one another. And finally, we have to ask ourselves, what kind of measures can we put out there that will actually gauge our improvement? So over the past year, the foundation has been working to develop an action framework that we hope will highlight some of the critical areas where we can come together and work to improve the health and well-being of our country. We wanted to develop a framework that was rigorous, and to do that, we engaged with the RAND Corporation, with leaders and experts across the country, and got a lot of valuable input on one key question, which is, what can we do to make sure that we're actually able to achieve the best health possible in this country. What is holding us back? That was the key question that was driving the impact framework. So what I want to do at this point is to share with you the framework and then hopefully to help you understand how together we can use this framework to build a vibrant platform for our campaigns and also a culture of health. We wanted this framework, which you'll see is 4 interconnected areas, to be a way that people who are already engaged in health could get it more engaged, but also a way that it could bring new allies into the work. And so one thing you'll see is that it builds on the report's recommendation that nursing increase its collaboration and build a greater constituency across many different sectors. This framework has 4 key areas that are interconnected. Each builds on the others, and a key component is Action Area 1, where it's moving to build a shared value of health. A key part of each of these action areas is that they have key drivers. And as you can see in this slide, the drivers for building a shared value of health are mindset and expectations, a sense of community, and civic engagement. These are not the kinds of measures that we usually think of when we see measures solely related to health. But it is critical to making sure that nurses are working across all of the key components. The drivers of these areas require that nurses have the tools that they need to empower care and to be advocates and be a more critical voice for improving health across the nation. So let me give you an example of how this can come together. Take, for example, a program called Vote in Vaccination. It's a program that was developed by the Robert Wood Johnson Foundation back in 2004. And it really tries to have people come to polling stations and vaccinate folks at the time that they're coming to vote. It has had a tremendous impact over the years since it was initiated, vaccinating over 44,000 people, many of them people who had never been vaccinated before. It's had an impact in 44 states and the District of Columbia. Well, just think for a moment about what would happen if nurses across all of our action campaigns partnered with pharmacies and others and made this kind of a program available in every polling place at every election across the country. Think about the tremendous collaborations and new constituencies that would be developed on behalf of nursing if we were able to do that. And think about the power of starting to do that right now. Now, together, the action areas and the drivers, we think, create the building block for actually continuing to build a culture of health over time. The measures which you see in your handout are important, but we anticipate that they're going to move over time, they're going to evolve, they're going to reflect the changing context of our healthcare system. But the drivers, we think, are going to be relatively stable. What we want to do, for example, in the measures related to the action framework, is to bring in new people. So that's why you see we've got measures related to the percentage of people who volunteer and why we've got measures related to the percentage of eligible voters who actually vote. And now you can see why I mentioned the Vote and Vax program as something that brings in new allies and also helps to build that shared sense of community. Most important, we hope that these measures and these drivers are going to create a menu of action, a way that different people can come in and work on this and also track the progress that they're making. Action Area 2 is fostering cross-sector collaboration to improve well-being. Now, this action area places new focus on collaborations, including sectors that have typically been outside of what we see as health. And progress in this area is going to require collaboration of the sort that we've seen in recent years, but it's also going to mean accelerating those partnerships so that they can reach their full potential. Now, the drivers in this area are designed to energize existing partnerships and to bring new allies together. Now, here's a real-world example related to this action area. Dow Chemical, which is based in Michigan, has taken a leadership role in something called the Michigan Health Improvement Alliance. It's a group of different stakeholders who are working to improve the health and healthcare delivery in 14 counties where they're actually working at Dow, where their employees are drawn from. And not only does this initiative benefit the community as a whole because of the broad range of areas that it focuses on, but it's also had a significant impact on the health of the Dow Chemical employees. They've been able to demonstrate a 13% reduction in diabetes expense among their population. They've also been able to demonstrate a decrease in costs related to other chronic conditions. So I want you to think about what would happen if every nurse in this room, if all of the coalitions in this room were to champion this kind of a community-wide effort in their community. What if you were to get nurses who are school nurses, who are occupational nurses, who are nurses in public health departments, to come together with business, with urban planners, with other governments, and ask, what can they do together to make their communities a healthier place? This is why it's so important for us to continue to move forward with the 2010 recommendations, because preparing nurses and enabling nurses to be leaders and to advance change and advance health is so critical to making this vision a possibility. Now, thank you. You have proven that when nurses, like the nurses in this room, commit themselves to lifelong learning, particularly lifelong interprofessional learning and collaboration, you're simply unstoppable. And the kind of change that we need would then become inevitable. So let me turn now to Action Area 3. This is about creating healthier, more equitable communities. And the goal of this action area is to encourage communities to fulfill their greatest potential in improving the environments in which their residents live, learn, work, play, by making the healthy choice the easy choice. And here, measures such as improving access to healthy foods, youth safety, emphasis on early childhood education, and bringing together all of the physical and social and environmental factors that actually do make the healthy choice, the easy choice, available for everyone. We've also included in this action area a measure about air quality, because we want to be able to track the percentage of the population that's covered by clean indoor air laws. And here I have to mention a leader who I believe is actually in the room, Charlotte Parent, who's also happens to be the Director of Health Department in the city of New Orleans. And thanks to a collaboration between the health department and also community advocates, New Orleans, which I will say is the place of my father's birth, and a city that you don't often think of as being one that has got a healthy environment related to smoking, has actually put in place a public ban on smoking. And the opportunity to do that came from a collaboration that was led by nursing and really speaks to how we can make our communities healthier and more equitable. So I hope you'll look forward to, yes, give Charlotte a hand. And I hope you'll ask her lots of questions later this afternoon. So let me turn to Action Area 4 now, which focuses on strengthening the integration between health services and systems. Now, this action area aims to strengthen the system of coordinated care and looks to better integrate the balance between medical treatment, public health, and social services by driving access and improving the consumer experience and improving the quality and integration of services. We think we can help build a culture of health that empowers both patients and providers. Now, some of you may know Jan Walker, who's a nurse, has a background in business, but also in health services research, and she really understands the importance of giving patients information that they can use to better improve their own health care and to make decisions about their community. Now, Jan, along with Tom Delbanco, who's a researcher, physician researcher at the Beth Israel Deaconess Hospital in Boston, created a program called Open Notes. It's very simple, but revolutionary, because it shares information with patients in a way that encourages them to be more active participants in their care. On the face of it, it's very simple. As Jan Walker knew, we already collect and record a lot of information in the patient record. But up until now, we weren't sharing that routinely. But now that many more of our records are digitalized or computerized, it's easier to share that information. The key to their model is transparency. That is sharing the findings and the notes in real time with the patients. And what that does, what Open Notes does, is it creates a new kind of clinician-patient dialogue that is really taking over. It's a very clear example, in my mind, of the magic that can occur when nurses and physicians collaborate with patients and the community in mind. So I want you to think about the kind of collaboration that can not only improve patient care, but also can create healthier communities when we look beyond what's happening simply at the bedside or at the clinic and think about the impact of the community environment on that patient's ability to actually achieve good health. It's important to point out that in this action area, access to care is a critical component. And if you look at your handout, you'll see that we have a measure related to access to care. And a key part of that is ensuring that all nurses and all advanced practice nurses are able to practice to the full extent of their education and training. Because yes, applaud that. Because we aren't going to be able to get access to care when, where, and how we need it, particularly for patients in underserved rural and urban areas, unless we have nurse practitioners, nurses, and everyone practicing to the full extent of their training. We've made progress in all four of these integrated areas, but we believe as a nation we are not going to get to the desired outcome of improving across the board population health, well-being, and equity unless we work in an integrated way. So I want all of you to help us. going forward, I want you to be focused on implementing the future of nursing recommendations. But I also want you to think about how they fit into these 4 action areas and how we can use this platform to build a culture of health through your extraordinary skills and opportunity and ability to join with others, not only within your sector and within your workplace, but outside of that, in your neighborhoods, in your communities. When I think about the incredible work that you've already done to improve the health of our nation, I'm asking you, put your foot on the accelerator just a little bit harder. Actually, no, a lot harder. Because when you see yourself as leaders in this framework, I think you'll begin to see how we can have a greater impact when we bring in partners and collaborators who are beyond the usual suspects. When you think about the recommendation that the report just gave, that we broaden that, I want you to go out and talk to folks who are in your action network, but who are outside of nursing or the healthcare arena. And this is something that I know that the coalitions have been doing, but think about what's happened in New Mexico, where they've recruited a new lead from the banking industry, an executive who is actually here today, I'm told, Francie Monith, who joined the coalition because she understands the importance of the good health of a community to the business, to their shareholders, and she knows that if they're going to actually improve health in New Mexico, she needs to work with people in the coalition. And she also knows that nurses are in all of the places that she needs to fund and to work with. They're working in areas of education. Nurses are the innovators. Nurses are the ones that are getting things done. So this room is filled with people just like that. What we need you to do is to take a moment, congratulate yourselves on all the work that has happened so far. So do that moment right now. Let's just congratulate yourselves. And then commit to action back in all of those 51 areas around the nation that you represent. And remember that this is not an impossible task. We can do this. If you just think about the words of Amelia Earhart, the most difficult thing is the decision to take action. After that, everything else is tenacity. And we have got tremendous tenacity in this room, including one person who already told us her name was Tenacity. So with that, thank you.